Hello everyone, my name is Lakshmi Nayak. I'm a neuro-oncologist and the director of the Center for CNS Lymphoma at Dana-Farber Cancer Institute in Boston, USA. I'm going to talk about the results of our study, which is a pilot study of axicabtagene ciloleucel in relapsed and refractory primary and secondary CNS lymphomas. The treatment of CNS lymphomas is really an unmet need. This is a very difficult population to treat. These patients respond very well to initial induction chemotherapy. However, the relapse and recurrence rates are very high. A group of patients are also refractory to initial induction chemotherapy, and so this poses an unmet need in population. We tested Axi-Cel or axicabtagene ciloleucel in this group of patients in a pilot setting. The primary endpoint of the study was to evaluate the overall safety, and as a secondary endpoint we were also going to evaluate efficacy. We accrued 18 patients, out of which 13 patients had primary CNS lymphoma and the rest had secondary CNS lymphoma. We found that Axi-Cel was very safe and well tolerated in these patients. One point to note is that the initial studies that were conducted with Axi-Cel did not include CNS lymphomas, and these patients were excluded from the initial studies because of safety concerns, particularly due to a high risk of neurotoxicity. In our study, we actually did not find a higher risk of neurotoxicity in brain tumor patients, and the risk of ICANS was similar to that seen in the systemic DLBCL patients. With regard to efficacy, we were very pleasantly surprised. We saw a high rate of efficacy. 94% of our patients had an overall response. Out of this, 67% of patients had a complete response. And importantly, these responses were durable. Our median progression-free survival was 14 months, and the median durability of response was 13 months. More than 50% of our patients had a PFS of 12. This is very promising therapy in our patient population where relapses are common and survival after relapse is quite poor, and we're very excited about these results.